Okay, so the idea is to talk about blunt cerebrovascular injury, also abbreviated as BCVI. So this we're talking about trauma and blunt trauma because it's blunt cerebrovascular injury, and we're talking about disruption and damage to the blood vessels of the head and neck. And we'll see that especially we're talking about the carotid artery, the vertebral arteries, those are the main arteries that are affected. This is not a very common injury, but when it occurs, there are grades and it can be quite devastating, especially without treatment. So BCVI, blunt cerebrovascular injury, we are talking about injury to blood vessels, and there are mechanisms for it. There are the stretching and shearing as the blood vessels stretch. There are the compression, blunt trauma that cause compression to it. Fracture can cause damage to the blood vessels. And as we said, the most common arteries that are affected are the carotid arteries and the vertebral arteries. Now, it can compromise blood vessels, for example, for the brain, and it can cause stroke by ischemic stroke and things like this. And those are the symptoms according to the pathophysiology, to the mechanism. Neurological deficiency, swelling in the area, hematoma in the area, cranial nerve palsies. Think about this when you approach those patients. And there are risk factors, but you need to remember that many patients don't have risk factors for this kind of damage and still for BCVI and still have BCVI. So think about it when you have head and neck injury in trauma patient, high energy mechanism, cervical spine fractures, fascia fractures, and especially Lefort, and especially Lefort 2 and 3 because they are the worst one. Remember the Lefort fracture, transverse fracture, pyramidal fracture, and transverse in here fracture. All of them should include the pterygoid plate. So those are the Lefort fracture. And when you see Lefort fracture, think about BCVI. Think about it also when you have skull base fracture and hanging fractures. Now, when we get into diagnosis, maybe the the biggest modalities for this is the DSA, which is quite invasive, and the CTA, which is much more commonly used because it is much more practical in use. DSA is maybe better for identifying pathologies in blood vessels, yet it's much more invasive, not very practical to use it compared to CTA, which is quick, non-invasive, and very easy to use and easy to get. So CTA, especially multi-dimensional CTA, is very commonly used in those trauma patients and maybe the most commonly used. Also, there is MRA and duplex in ultrasound, but they are less standardized and less commonly used, especially when you are thinking about ultrasound. You have a trauma patient with they should be quite high energy trauma patient, so they will have collar and they will have many instruments that will make using ultrasound not an ideal modality to identify those injuries. Now again, the gold standard is the DSA, the catheter and catheter angiography, but again it's less practical for use. But still, when there is high suspicion and the CTA is negative, you should consider DSA. Okay, so what is the treatment? Before I talk about treatment, let's talk about grading, because the treatment is based on the grading. There are grading for BCVI. When, as the grade goes up, the injury is worse, as you can understand. Grade 1 is minimal intimal injury. When you are looking at the blood vessel, you will see less than 25% luminal narrowing. Often it is managed with antiplatelets, and the idea of the antiplatelets is that you need to remember that those injuries can cause post-injury stroke. So antiplatelets can manage those patients and make them not to develop stroke. Now, remember that this stroke as a complication of those BCVI can occur in hours, but in also months after the injury. Most commonly in the 72 hours after injury, but if a patient is asymptomatic initially, it doesn't say that he won't develop complications. So remember this in BCVI. So for grade 1, less than 25% intimal luminal narrowing. So usually antiplatelets is the treatment of choice. Grade 2 is when there is a more than hematoma, a dissection, and more than 25% luminal narrowing hematoma. Grade 3 is pseudoaneurysm. And we're talking about treatment. The grade 2, the more than 25% luminal narrowing, we can talk about antithrombotic treatment, low molecular weight heparin, anticoagulants, and things like this. Grade 3, grade 4, grade 5. Grade 3 is pseudoaneurysm, and there can be an arteriovenous fistula. This may require endovascular treatment or surgery. Grade 4 is transection, and grade 5 is active extravasation of leakage of blood. Those needs to be treated endovascularly or surgically. So there are mainly 5 grades: luminal under 25%, luminal more than 25%, pseudoaneurysm with maybe arteriovenous fistula, transection, and active extravasation of blood. Grade 1 antiplatelet, grade 2 antithrombotic, grade 3, grade 4, grade 5 consider endovascular or surgical treatment. Again, to treat this condition and to reduce the likelihood of complications, including stroke. So, we talk about the diagnosis, the treatment, and complication. We talk about ischemic stroke that can be caused by blockage, and of course, death in very severe. Think about transecting your carotid artery. It's not a very good idea. Okay, so BCVI, blunt cerebrovascular injury, is a very serious condition. There are grades. You need to diagnose it. You need to think about it. It's not very common, but when it happens, it may be very devastating. There are treatment. You need to identify it in order to treat those patients. Remember, there are modalities. CTA is not completely sensitive. DSA is more gold standard, but it's less commonly used because it's not that easy to use. So CTA is maybe the most commonly used type of imaging modality for this. And there are patients that go throughout whole body CT in order to identify all the injuries and not to miss anything. And this is about BCVI. The treatment is based on the grading, and don't forget the presentation clinically, and think about it, and think about it. BCVI, blunt cerebrovascular injury. Thank you very much. If there are any mistakes or correction, please tell me, and that's it.